Welcome to the Deep Dive. Today we're tackling a topic that's really important for a lot of people, in vitro fertilization, or IVF. It's an amazing medical option, offering a path to parenthood, but the journey, well, it isn't always straightforward.
Absolutely. While IVF is a huge step forward, success isn't guaranteed. It really depends on a whole mix of biological factors.
Exactly. So for this deep dive, we've looked at information focusing on the Berkeley Center for Reproductive Wellness. Our goal is to explore some complementary medical approaches that, based on their experience, seem to potentially help improve IVF outcomes.
Yeah, and it's important to say we're looking at potential supportive therapies here, things designed to work alongside, the standard IVF protocols.
Right, not replacements.
Mm.
So the Berkeley Center's work really highlights three main areas: acupuncture, customized herbal medicine, and also low-level light therapy, or LLLT.
Mm-hmm. And these are considered relevant to IVF because, well, the sources we looked at point to several physiological things that can get in the way of success. We're talking about things like the quality of the eggs, the oocytes.
Okay. How receptive the uterus is, sperm quality, of course, hormonal balance, and even just overall systemic stress.
Okay, let's maybe break down why IVF can sometimes be challenging to begin with. Most people know it involves several stages, right? Stimulating the ovaries, retrieving the eggs, fertilization in the lab, and then transferring the embryo.
And at every one of those steps, different biological factors really come into play. Plus, we know success rates vary quite a bit. Age is often a big factor there.
Right. The source material really digs into some key reasons why an IVF cycle might not, result in a pregnancy. Let's start with egg quality. What's the main thing to understand there?
Well, a big one is age. As women get older, especially, say, past their mid-30s, the number of eggs generally goes down, and the quality of the ones that are left can decline too, and that can affect whether the embryo implants properly and develops as it should.
That makes sense. And then there's the uterine lining, the endometrium. Why is that so critical? You can think of the endometrium like the soil for a seed. For an embryo to really take root and grow, the lining needs to be thick enough, usually somewhere between 7 and 14 millimeters. And it needs to be receptive, sort of ready to welcome the embryo. If it isn't, implantation might not happen.
Got it. And it's not just about the eggs or the uterus, is it? Sperm quality is a big piece of the puzzle, too.
Oh, absolutely. Things like the sperm count, how well they move, that's motility and their shape, morphology. They're all crucial for fertilization and for creating a healthy embryo. So yeah, issues with sperm can definitely impact the outcome.
The sources also mention hormonal balance. How can, imbalances mess things up?
Well, the whole reproductive process relies on this really delicate dance of hormones. If things are out of balance, it can interfere with, well, pretty much everything, from getting healthy eggs to develop in the first place right through to preparing the uterus for the embryo. So keeping hormones stable is really key.
Like too much or too little estrogen at the wrong time.
Exactly. Or progesterone. Timing and levels are critical.
And the last point was stress, something we all deal with. How does that connect to IVF success?
When we're under chronic stress, our bodies often pump out more cortisol. And the source material suggests this high cortisol can negatively affect different parts of our reproductive system. It might make IVF less effective. The thinking is it can interfere with hormones signals, maybe even blood flow to the reproductive organs.
Okay, so given all these potential hurdles, it brings us back to the main question. How could these complementary approaches, acupuncture, herbs, LLLT, actually help?
Well, the idea, based on the experience at the Berkeley Center, is that these therapies might be able to target some of those underlying factors we've just talked about in a way that sort of complements the conventional IVF treatment.
Let's start with acupuncture then. For people who aren't familiar, it involves inserting really thin needles at specific points. How could that possibly improve IVF outcomes?
So the basic idea is stimulating these specific points triggers physiological responses in the body. For IVF, the source highlights a few potential benefits.
Such as?
One main one is potentially improving blood flow perfusion to the ovaries and the uterus. Better circulation means more oxygen, nutrients, hormones getting to where they need to go, which is obviously critical for developing healthy eggs and also for building up that receptive uterine lining.
And there's evidence for that?
Interestingly, yes, the source mentions Doppler ultrasound studies have actually shown this increased blood flow after acupuncture. So it's something measurable.
Okay, that's tangible. What else might acupuncture do?
It's also thought to help regulate hormones. It might influence what's called the hypothalamic pituitary ovarian axis.
That sounds complicated.
Yeah, it's basically the body's command center for reproductive hormones. By helping to balance those hormone levels, acupuncture could contribute to more regular ovulation and maybe create a better environment in the uterus for the embryo.
And we mentioned stress earlier. Can acupuncture help with the stress of IVF?
That's another potential benefit. Acupuncture seems to stimulate the release of endorphins, those natural mood-boosting chemicals. And that process can help lower cortisol, the stress hormone, and just promote relaxation, which, given how stressful IVF can be, it could be really valuable.
The source mentioned a specific study, a randomized controlled trial from 2002.
Right. That study looked at 160 people doing IVF. They tested giving acupuncture right around the embryo transfer before and after, and the results were pretty striking. The clinical pregnancy rate was 42.5% in the acupuncture group versus just 26.3% in the group that didn't get it.
Wow, that's a big difference.
It was statistically significant, too. The source notes a p-value less than 0.05, which generally means it's unlikely the result was just random chance.
That is compelling. And timing seems important. What does the Berkeley Center usually recommend for timing acupuncture with IVF?
Their advice is usually to start acupuncture maybe 2 to 3 months before the IVF cycle actually begins. Then they suggest weekly sessions while the ovaries are being stimulated, and then treatments on the day of the transfer itself, both before and right after.
Okay, let's shift gears to customized herbal medicine. Customized sounds very tailored.
Exactly. It's not a one-size-fits-all approach. These herbal formulas are specifically created for each person. It's based on a really thorough assessment, their individual constitution, medical history, any specific imbalances they might have according to traditional diagnostics.
And how might these specific formulas help women's fertility?
Well, for women, the goal is often to help regulate hormones, support healthy ovulation, and improve the thickness and quality of the endometrial lining, that receptivity factor again. The source even mentions they might help manage conditions like PCOS or endometriosis, which can definitely make fertility more challenging.
What about for men? Can herbs play a role in improving sperm?
Yes, they can. Certain herbal formulas are used to try and improve sperm count, motility, how well they swim, and their shape or morphology. There's research suggesting that herbal treatment over, say, about 3 months might even help reduce sperm DNA fragmentation, which is good for fertilization.
And systemic effects, too.
Yeah, the herbs might also have broader benefits that contribute to the overall vitality of the sperm.
The source brought up a 2015 systematic review. What did that find about herbs and IVF?
Right, that review looked at 40 different studies. The overall analysis suggested that when herbal medicine was used with IVF, the odds of getting pregnant were about 1.5 to 2 times higher compared to just IVF alone.
Another encouraging finding. How does the Berkeley Center handle the herbal medicine part?
They really emphasize working with board-certified herbalists who know how to create these personalized formulas, and they usually recommend treatment for about 3 to 6 months. It takes time for the herbs to have their intended effect.
All right, third intervention. Low-level light therapy, LLLT. This sounds quite different. What's the basic idea?
Yeah, it is different. LLLT uses specific wavelengths of light, and the idea is to stimulate the mitochondria inside our cells.
The powerhouses of the cell.
Exactly. Mitochondria produce the cell's energy, ATP. So this light stimulation is thought to kind of boost their function, ramp up energy production, like jump-starting a tiny battery.
Okay, how does boosting cell energy help with fertility?
Well, for eggs and sperm, the thought is that increased ATP and reduced oxidative stress could improve their quality and viability. The source mentions lab studies, in vitro studies, showing better mitochondrial activity in reproductive cells after LLLT, which could potentially help fight some of that age-related decline we talked about.
Does it help the uterine lining too?
Potentially, yes. LLLT is thought to promote angiogenesis. That's the formation of new blood vessels. It might also help repair and regenerate cells in the endometrium. So the end result could be a thicker, healthier, more receptive lining, again boosting the chances for implantation.
There was a study mentioned about LLLT in women with low AMH.
Yes, a 2017 study. It involved 188 women with low anti-Mullerian hormone levels, which often indicates lower ovarian reserve. After getting LLLT, the study reported a 56% pregnancy rate and a 38% live birth rate in that group.
Those are pretty notable results, especially for that group. And how is LLLT done? Is it invasive?
No, it's not invasive. It's usually administered about 3 times a week. The Berkeley Center mentions they use FDA-cleared Saluma devices, so they're using established technology.
We keep coming back to the Berkeley Center for Reproductive Wellness. They seem to have been doing this for a while.
They really have. They're based in Midtown East Manhattan, and they were actually the first complementary reproductive medicine center in the U.S. Mike Berkeley founded it back in 1998.
Wow, 1998.
Yeah, so that's over 27 years of specializing specifically in this kind of integrative fertility care.
And Mike Berkeley himself, he's quite well known in this field.
He is. He's a licensed acupuncturist, board certified in Oriental reproductive medicine, and really considered one of the pioneers in the U.S. focusing just on reproductive health with these methods. He has a strong reputation.
And it sounds like working with conventional doctors is important to their approach.
Yes, definitely. They're known for personalized care and building relationships with many top reproductive endocrinologists, the REs, in New York City. They work with doctors and clinics at places like RMA, NYU, Generation Next, Fernie, New Hope, Cornell, lots of the big names. It points to a really integrated model.
And what about patient experiences? What does the feedback look like?
Generally, it seems very positive. You see a lot of reports from patients who finally got pregnant after previous IVF cycles hadn't worked. Reviews often mention Mike Berkeley's knowledge, how attentive the care is, the supportive feeling at the center. They've got high ratings on Yelp, good testimonials on ZocDoc, Google.
Any specific examples stand out?
The source mentions one case of a successful transfer after 6 previous failures, and another patient who really valued the stress relief and holistic support even into her second trimester.
That's great to hear. And they seem to make it accessible, too.
Yeah, they offer flexible scheduling, and they even do home visits and telehealth, which must be a huge help when you're going through the demands of fertility treatment.
Now, the source also gave us some hard data on IVF success rates, that age and the impact of PGTA, that genetic testing. Let's get into that.
Right. So the data, this is from SART and HFEA, around 2020, 2021. It clearly shows that trend. As women using their own eggs get older, the live birth rates per embryo transfer tend to go down if you're not doing PGTA.
Can you give us a rough idea of those numbers?
Sure. So for ages 35 to 37, the live birth rate per transfer is maybe 30% to 38%.
Okay.
Then it drops for ages 38 to 40, down to maybe 17% to 25%.
Quite a drop.
Yeah. Then 41 to 42, it's lower still, like 10% to 13%. And by ages 43 to 45, it's significantly lower, maybe 4% to 6% per transfer without PGTA. And the miscarriage risks, unfortunately, go up with age, too.
So that's where PGTA, the pre-implantation genetic testing for aneuploidy, comes in. Explain that again briefly.
Right. PGTA is basically screening the embryos before transfer. It checks for the wrong number of chromosomes that's aneuploidy. By picking embryos that have the right number, the euploid ones, the aim is to boost the chance of implantation and cut down the miscarriage risk.
And does the data show it makes a big difference, especially for older women?
Yes, it really seems to. For that 35-37 group, using PGTA to choose a euploid embryo can push the live birth rate per transfer up to maybe 40-50% and lower miscarriage risk.
That's significant.
And the benefit gets even clearer as women get older because the chance of having chromosomally abnormal embryos naturally increases quite a lot. The source estimates it's maybe 50-70% by age 40 and could be 80-90% by age 45. So for that 43-45 group, finding and transferring a euploid embryo could potentially give live birth rates of, say, 25-35% per transfer.
Yeah.
Much better odds.
So PGTA definitely improves the odds for that specific transfer, especially when aneuploidy risk is higher due to age.
Exactly. But there's an important point the source makes. While PGTA improves the per transfer success rate, it doesn't necessarily increase the overall chance of having a baby across multiple cycles, because the testing itself might mean you find fewer embryos that are suitable for transfer overall.
Ah, okay. That's a critical distinction. Fewer shots on goal, potentially, but each shot is maybe more likely to score.
Sort of. Yeah, that's a decent analogy.
So pulling it all together,
Yeah.
how does the Berkeley Center suggest actually integrating all this? The acupuncture, the herbs, the LLLT with the conventional IVF?
Well, based on their experience, they outline a few key steps. First, choose qualified practitioners. Their team are licensed pros, and crucially, they coordinate with the patient's RE.
Okay, collaboration is key.
Yes. Second, start early. Ideally, begin these complementary therapies about 3 months before the IVF cycle kicks off.
Why 3 months?
It's thought that's roughly how long eggs and sperm take to mature. So starting early gives time to potentially optimize their quality and the uterine environment, too.
Makes sense. Consistency matters, too, I imagine.
Absolutely. They advise sticking to a regular schedule, typically twice weekly acupuncture, taking the prescribed herbs consistently, doing the LLLT sessions. And they also mention that if pregnancy occurs, they often continue modified acupuncture weekly, up to about week 13 to support the early stages.
And what about managing the stress component we talked about?
They highlight acupuncture's potential there, specifically its ability to help reduce anxiety and emotional stress. That can be a huge support during such a demanding
And
process.
fine.
Coordinated care, just ensuring everything works together seamlessly with the patient's main IVF plan. Offering things like home visits and telehealth helps make that integration easier.
So, summing up, it sounds like adding these complementary approaches could offer real hope, maybe improve chances, particularly for people in that, say, 35 to 45 age bracket where IVF success rates tend to dip.
That seems to be the key takeaway. Using acupuncture, tailored herbs, LLLT, the goal is to directly address some of those critical factors, egg quality, sperm health, uterine receptivity that can really hinder IVF success.
And the Berkeley Center for Reproductive Wellness clearly positions itself as a very experienced place for this kind of integrated approach.
Yeah, definitely. With over, 27 years doing this and that focus on personalized, evidence-informed care, they offer a pretty comprehensive way to support people trying to build their families.
So if you listening are interested in learning more about the Berkeley Center, their methods, you can reach them at 212-685-0985. Or check out their website. It's www.berkeleycenter.com. It sounds like they really work on individual plans to help optimize IVF outcomes.
This whole discussion really highlights the potential of looking at things more holistically. Proactively addressing different physiological factors, integrating various therapies, it makes you think, doesn't it? About how combining the strengths of conventional medicine and these complementary approaches might really shift the landscape for fertility treatment in the future, empowering people more on their journey.